Chronic injury is an injury, pain, or illness that develops over time and gradually gets worse and lasts for a long time. One of the chronic injuries is tennis elbow. Tennis elbow is described as the type of pain on the outside of the elbow and is caused by straining or overusing the muscles and the tendons in the forearm. The signs and symptoms of tennis elbow are pain on the outside of the elbow or just below the elbow and potentially pain travelling down towards the wrist. It could be painful when lifting an object or bending of the arm. Pain when writing or gripping small objects, for example, holding a pen to write with. Potential pain when twisting the forearm, such as trying to open a jar or open a door. Or it could be potential pain when extending the arm fully outwards. Another chronic injury is golfer's elbow. Golfer's elbow is the definition used for pain in the tendons in your forearm and around the inside of your elbow joint. This is caused by repetitive usage of the wrists or repetitive clenching of the fists. The signs and symptoms of this are pain or tenderness on the inner side of the elbow or pain alongside the inner part of your forearm. This pain can get worse with certain types of movements too. Could be stiffness of the elbow, which may hurt when trying to make a fist. You may have potential weakness in your hands and wrists, or potentially numbness or tingling in the fingers or hands. Another chronic injury could be shin splints. Shin splints is the name used for pain in the lower area of the legs and on the inside of the shin bone. This is also known as the tibia. This pain is caused by continuous pressure being put on the lower area of the legs. This can happen by exercise such as gym exercises like leg press machine, and could also be caused by wearing the incorrect footwear during exercise and develop into shin splints over time. The signs and symptoms of shin splints are one of the signs that can show potential shin splints is tenderness, soreness, or pain in and along the inner part of the lower legs. Another symptom could be little swelling in the lower leg. Another chronic injury could be stress fractures. Stress fractures are little small cracks in the bone where repeated continuous pressure is being put on that area. Physical activity on hard grounds for long amounts of time can lead to stress fractures. Signs and symptoms of this are, one sign of stress fractures could be tenderness that gets worse in a certain area during physical activity over time, or there may be some swelling in that area which is worsening. The last chronic injury is tendinitis. Tendinitis occurs when a tendon becomes inflamed or swollen, and it can get worse with exercise and could potentially lead to a torn or ruptured tendon or multiple tendons if left untreated. The signs and symptoms of this is there could be potential pain like a dull achy pain when moving the limb or joint, potential tenderness, or potential mild swelling. Acute injury is caused straight away by a sudden impact or a certain powerful force hitting a specific area of the body or a certain type of movement that the body is not fully capable of doing or prepared for that can lead to this injury. One of the acute injuries is sprains. Sprains happen when ligaments have been overstretched or twisted during activity. The signs and symptoms of sprains are pain around the joint area, struggle of using the joint normally or putting a weight on it, or swelling, soreness, or potential bruising in the injured area. Another acute injury is strains. Strains happen when muscle fibers tear or stretch. Signs and symptoms of strains are there may be potential swelling, bruising, or redness around the injured area, pain in the muscle when resting and using the muscle, potential muscle spasms, or weakness in the affected or injured muscle area. Another acute injury is broken bones. Broken bones are also described as fractures in the bone which cause the bone to crack or break. Some of these fractures can be worse than others, such as hairline fractures is a small fracture through the bone, and a worse one is an open fracture, which is where the bone completely snaps and could poke out of the skin. Signs and symptoms of broken bones are pain, swelling, bruising. The area may be discoloured. The injured area may be an unusual shape to what it normally is. The injured person will not be able to apply pressure or weight on the injured area, like standing up. They will not be able to move the injured area, or they may be bleeding if it is an open fracture. Another acute injury is dislocation. Dislocation happens when the end of a bone is forced away from the joint it's attached to. Signs and symptoms of this are being able to see the bone out of its normal place, potentially being swollen or a different colour to what it normally is, would cause a large amount of pain in the area, and the injured area would not be functional and immovable whilst dislocated. The final acute injury is torn ligament. Ligaments are what attach a bone to another bone at joints. Overstretching or twisting the ligaments can cause the ligaments to tear. The signs and symptoms of torn ligaments are a lot of pain at the joint, feeling of instability and feeling like the ligaments and joint are about to break or collapse, swelling around the area of the ligaments and joint, not being able to function properly in that area, also known as loss of movement.